When people hear the word ringworm, they often imagine an actual worm living under the skin. But despite the name, ringworm has nothing to do with worms at all. Ringworm is actually a very common fungal infection that affects the skin, scalp, feet, and even nails. It spreads easily, causes irritating symptoms, and can affect people of all ages. In this video, we'll explain what ringworm really is, how it spreads, the symptoms to watch for, the best treatment options, and simple ways to prevent it. By the end of this video, you'll have a clear understanding of how to recognize and deal with this common infection. What is ringworm? Ringworm is caused by a group of fungi known as dermatophytes. These fungi survive by feeding on keratin, a protein found in the outer layer of skin, hair, and nails. The medical term for ringworm is tinea. The name changes depending on the area of the body affected. For example, ringworm on the body is called Tinea corporis. On the feet, it's known as athlete's foot or tinea pedis. In the groin area, it's called jock itch. Ringworm on the scalp is known as Tinea capitis, while infections of the nails are called Tinea unguium. The infection often appears as a circular or ring-shaped rash with raised red edges and clearer skin in the center. That ring-like appearance is where the name ringworm comes from. These fungi thrive in warm, damp environments, making sweaty skin, locker rooms, public showers, and tight clothing ideal places for the infection to spread. Hashep, how ringworm spreads. Ringworm is highly contagious and spreads in several different ways. The most common method is direct skin-to-skin contact with an infected person. Even brief contact can sometimes transfer the fungus from one person to another. It can also spread indirectly through contaminated objects and surfaces. Shared towels, clothing, hairbrushes, gym mats, bed sheets, and even furniture may carry fungal spores. Animals can spread ringworm too. Cats, dogs, and farm animals are common carriers. Sometimes pets show obvious patches of hair loss, but other times they may carry the fungus without visible symptoms. Certain conditions increase the risk of infection. Excessive sweating, humid weather, poor ventilation, wearing tight shoes, or walking barefoot in public places can all make infection more likely. People with weakened immune systems may also be more vulnerable to severe or recurring infections. Symptoms of ringworm. The symptoms of ringworm can vary depending on where the infection appears. On the skin, ringworm often begins as a small red patch that slowly expands outward. The border may become raised, scaly, or itchy while the center appears clearer. Many people experience itching, burning, dryness, or cracked skin. Some cases remain mild, while others become inflamed and uncomfortable. When ringworm affects the scalp, it may cause flaky patches, itching, and temporary hair loss. In children, scalp infections are especially common and can spread rapidly in schools or households. Ringworm of the nails can cause nails to become thick, brittle, yellow, or misshapen. Nail infections are often more difficult to treat and may require several months of medication. Because ringworm can resemble other skin conditions such as eczema or psoriasis, proper diagnosis is important. Diagnosis and treatment. Doctors can often diagnose ringworm simply by examining the affected skin. In some cases, a small scraping of skin or nail material may be collected and examined under a microscope to confirm the presence of fungus. Most mild cases of ringworm can be treated with over-the-counter antifungal creams. Common medications include clotrimazole, terbinafine, and miconazole. These creams are usually applied once or twice daily for several weeks. Even if the rash appears to improve quickly, treatment should continue for the full recommended period to prevent the infection from returning. More severe infections, especially those affecting the scalp or nails, may require prescription oral antifungal medications. These treatments work from inside the body and are often necessary when topical creams are not enough. Good hygiene also plays an important role in recovery. Clothing, towels, bedding, and personal items should be cleaned regularly to avoid reinfection. One important warning: steroid creams should not be used unless specifically recommended by a healthcare professional. Steroids can sometimes worsen fungal infections or hide symptoms, making diagnosis more difficult. Prevention. Preventing ringworm starts with keeping the skin clean and dry. After bathing or exercising, it's important to dry the body thoroughly, especially between the toes and in skin folds where moisture can build up. Avoid sharing personal items such as towels, hats, brushes, or clothing. In public showers, locker rooms, and pool areas, wearing sandals or flip-flops can help reduce exposure to fungi. Gym clothes and sports equipment should be cleaned regularly. Athletes involved in close contact sports, such as wrestling, should check their skin frequently for suspicious rashes. Pets should also be examined if ringworm is suspected in the household. Veterinary treatment may be necessary to stop the spread of infection. Simple hygiene habits can greatly reduce the risk of ringworm spreading between family members, classmates, teammates, or coworkers. Conclusion: ringworm is a common fungal infection that can affect almost anyone. While it may be irritating and highly contagious, it is usually treatable with the right medication and proper hygiene. Recognizing the symptoms early and starting treatment quickly can help prevent the infection from spreading or becoming more severe. If a rash continues to grow, becomes painful, or does not improve with treatment, it's important to seek medical advice from a healthcare professional. Thanks for watching, and remember, staying informed is one of the best ways to protect your health.